Back pain, surgery, sports, how I fought for my spine.
Привет.
Hi, my name is Andrei Kupiakov. I'm 63 years old. I'm a former professional athlete, a USSR Master of Sport in saber fencing, and now an active veteran fencer. In August 2024, I underwent spinal surgery. 6 months later, I was back on the fencing strip, and just a couple of months after that, I won the national championship first, then the European title. I'm not a YouTuber or a doctor, so in advance I apologize for the video quality, and for any inaccurate medical terminology. I'm a former patient who delayed surgery for a long time, fortunately, not until the very last moment, because the risk of ending up in a wheelchair had become very real. It was my friends who encouraged me to record this video. They believe it might help someone facing similar challenges. In my early conversations with doctors, when I first came in with complaints, I heard terms like radiculopathy, sciatica, and nonspecific back pain, but as I understood it, these weren't diagnoses, just descriptions of symptoms. The root causes of the problem were essentially unknown at first examination. There could be many, and that was confirmed by the results of my MRI. The report from that scan filled an entire page. Pathologies were found in nearly every segment of the lumbar spine, but the most critical was the condition of the L3, L4 segment. There they found pseudoventralolisthesis, a partial vertebral displacement, bilateral hypertrophy of the facet joints, bilateral foraminal protrusion of the intervertebral disc, signs of neuropathy in the L3 nerve roots on both sides, bilateral thickening of the ligamentum flavum and advanced spinal canal stenosis, a 4 mm cyst in the left intervertebral foramen, in the nerve root recess, which caused narrowing of the space, and neuropathy of the left L4 nerve root. Now I'll tell the full story, step by step, but I won't mention any names or the full names of medical institutions, primarily for ethical reasons, and also because I don't want this video to come across as promotional. Let's hope for the best. How I was destroying my own back. For over 20 years now, I've lived and worked in Germany, in the city of Bonn. It was here that I got back into sports after a 20-year break. At first, I fenced just for myself. Then gradually started entering tournaments. Mostly veteran competitions, of course. My back problem started a long time ago. Around the age of 50. Now, after countless conversations with doctors, and reflecting on everything that happened, I realized that those problems could probably have been avoided or minimized. Honestly, I didn't take care of my spine at all, overestimating the value of my athletic background. I ignored the natural aging process. I heard that phrase more than once. I proudly carried heavy objects wardrobes, refrigerators, washing machines. I blamed the pain on fatigue, awkward movements, or drafts. And the phrase I used most often to reassure myself was, it's nothing, it'll go away in a couple of days. And all this while working for the past 30 years. In a seated position under high mental pressure. If the word newsroom means anything to you, you'll know what I mean. Like many others, I ignored the rules of working in an office, but those rules exist. I only started working standing up at my computer after the surgery, and I've stuck with it ever since. Among other reasons, I should probably mention my attitude toward sports. After returning to the fencing strip, it was my attitude, not the sport itself. I basically neglected general physical conditioning. And that was a fatal mistake. Because fencing is an asymmetrical sport. And GPC, general physical conditioning, as we used to call it, is absolutely essential. One of the doctors, by the way, who gave me spinal injections, said right away that the muscles in my back, especially on one side, were in pretty bad shape. In the 90s, I'll be honest, I abused alcohol. To a degree that, of course, takes a toll on the spine. But that's a separate topic. I'm only mentioning it now, because it really is one of the contributing factors. Another likely cause was a serious car accident I was in back in 2019. I was driving, it was a head-on collision. Apart from bruises and minor burns from the airbag, I was fine. But they didn't do an X-ray at the time, and my back hurt for a while. Right at the spot where the seatbelt had pressed, at that level. Another common and scientifically proven cause is, of course, stress. Work stress, everyday stress, stress from the accident, and from everything happening around us lately. Natural degenerative changes, smoking, genetics. I won't even go into that, it's self-evident. Doctor, I've got a problem. In May 2023, I realized something was wrong with my back. After every training session or long walk, my lower back would ache. I'd feel the urge to bend forward and stay in that position for a while. Standing in lines became pure torture. I started losing sensation in my big toes and the outer sides of my calves. Eventually, I couldn't take it anymore. I went to see an orthopedist. He referred me for an MRI. I've already talked about the results. Reading those kinds of reports as a patient isn't exactly helpful. Turns out, as I learned, no one over the age of 25 has a normal spine. And when reading radiology reports, you need to take a philosophical approach. It only makes sense to sound the alarm when something truly hurts or deeply worries you. Personally, I made a promise to myself, if nothing hurts badly, I'll never insist on getting an X-ray, CT scan, or MRI. After reading the report, the orthopedist gave me a few blocks, superficial cortisone injections into the spine, and referred me to therapeutic exercise. Later, on my own initiative, I spent a lot of money on chiropractic sessions, pain relief gels, and ointments. But honestly, I didn't feel much relief. The pain didn't go away. As for the money, I'll talk about that later. In July, our whole family went on vacation, as we always do. We traditionally spend it on the German coast of the Baltic Sea. There, I play table tennis with my sons. That was pretty much all I could manage. Playing regular tennis had become difficult. And every 5 minutes or so, I'd bend forward and stay like that, just to ease the pain a little. During one of the games, I felt someone watching me. I turned and saw an elderly woman on a bench. She smiled at me in a strange way and gestured for me to come over. I walked up, and she said, "You have serious back problems. I can see it, you absolutely need treatment. Don't delay, please. You've got a lot of hard work ahead of you. I sincerely wish you strength and recovery." Next to her, I noticed a crutch leaning against the bench. I didn't take that moment seriously at the time, but I kept thinking about it afterward, and I still remember the look in her eyes. And now I wonder, why am I even telling this story? I don't know. Maybe because athletes are a superstitious bunch. At my very first training session after vacation, I immediately realized my condition had worsened. I had to bend forward after almost every movement. My back hurt like hell after training. Luckily, sitting didn't cause pain. But I couldn't lie on my back for long. The pain would intensify, radiating into the glutes, worse on the left side. Lying on my stomach was simply impossible. The least painful position was lying on my side with knees bent. I also started having more frequent cramps in my calves and anterior tibial muscles, especially at night. I went back to the orthopedist. This time, he prescribed an outpatient course of pararadicular pain therapy at one of the hospitals. And during that visit, for the first time, the word surgery came up. The orthopedist said that if the pain didn't ease, we'd have to consider surgery. After the very first deep injection, administered by a radiologist under CT guidance, I felt relief. Though the epicenter of the pain, now less intense, shifted to the right side, toward the sacroiliac joint and slightly upward along the spine. I received cortisone injections every 3 weeks. But after just a few days, the pain would return. And each time, it came back faster. After the second procedure, I wrote in the chat of our fencing group that I wouldn't be able to come to the gym for a while. At the time, I didn't know that a while would turn into more than a year. But I kept rejecting the idea of surgery, pushing it away. During that period, I watched dozens of videos about similar problems, and I was searching for arguments against going under the knife. That same autumn, in 2023, I started keeping a pain diary. I recorded the location of every painful sensation, rated it on a 10-point scale, noted the dosage of each medication and its effect. I even created an infographic, which I later showed to every doctor I met. And in November, I was prescribed Tylodyne for the first time. Tylodyne is a synthetic opioid painkiller, and it really helped me manage the pain. Anything but surgery. Now I realize that back then, I wasn't really fighting my problems. I was doing everything I could to avoid surgery at all costs. I kept searching specialized websites and YouTube for information about conservative treatment options, and kept convincing myself that everything would still work out. Basically, I trapped myself in an information bubble. To this day, I'm amazed by the patience of my orthopedist and family doctor, whom I kept persuading to refer me for all sorts of procedures: acupuncture, massage, magnet therapy, shockwave therapy, manual therapy. My refusal to accept the idea of surgery even led me to inpatient pain treatment. 3 times, at 2-month intervals, I checked into a clinic in another city, 2 hours from home, for 2 or 3 days. There, the pain relief injections were administered by neurosurgeons, very deep, under brief anesthesia. The effect was stronger, and the pain subsided for longer periods. During the last hospitalization, after 1 injection, my left leg went numb from the hip down for several hours. I hadn't felt that kind of fear in years. I never expected it. I could see my leg, but I couldn't feel it at all, couldn't even wiggle my toes. The surgeon who gave the injection reassured me, saying that this time it had been placed very deep, and that everything would return to normal in a couple of hours. The gel-like mixture had likely compressed a nerve root. Later, I literally cried with joy when my big toe twitched and my leg began to come back to life. But at discharge, I heard the word surgery again. The neurosurgeons made it clear that pain relief procedures were no longer effective for me, and that this would be my last stay at that clinic. They recommended spinal fusion, a transpedicular fixation of 4 segments, but first and foremost, decompression of the spinal canal, widening the canal where the nerve bundle was compressed. But the fixation would span 4 segments, from L3 to S2. One of the doctors said that if the degeneration ascent stopped, I could end up in a wheelchair. I listened carefully, thanked them, but thought to myself, no way, thank you. 10 screws, 4 cages instead of intervertebral discs, and 1 massive vertebra instead of 5, I understood it. No thanks. Surgery is inevitable. Meanwhile, a year had passed since my first visit to the orthopedist. The entire arsenal of conservative treatment had been exhausted. Pain would only subside after taking Tylodyne or oxycodone. I was emotionally overwhelmed, still unable to accept that this wouldn't resolve on its own. The denial phase dragged on absurdly long. I kept repeating the phrase, surgery is the last resort, to myself like a mantra. At another appointment with the orthopedist, I was given a new referral for an MRI. The results were even worse. Relative stenosis had progressed to absolute, and joint deterioration had also worsened. The only small consolation was that one of the disc protrusions had disappeared. In total, 3 protrusions were identified in my lumbar spine. So I realized that conservative treatment wasn't entirely in vain. At that point, it seemed obvious, time to schedule surgery and see the surgeons. But I still had one more test, a so-called functional X-ray, to check whether the spondylolisthesis, vertebral slippage, was stable or unstable. Ironically, it turned out to be stable. The vertebrae didn't shift much during bending or arching. I perked up and proudly handed the report to my orthopedist. He just shrugged and said that in my place, he'd still go ahead with the surgery. Because regardless of what the X-ray showed, and regardless of how many issues I had throughout the lumbar region, absolute stenosis simply can't be treated with conservative methods. And just a couple of days later, my left leg intervened in the matter, the same one that had scared me at the clinic where I got injection. One day, I was out with my wife, stopped the car, opened the door to get out, but my left leg gave way, buckled helplessly, and I fell. I basically collapsed out of the car right in front of my wife. That was the moment of truth. I instantly remembered the terrifying feeling of temporary one-legness and the neurosurgeon's warning about ending up in a wheelchair. The next day, thanks to my friends, I began consulting with specialists from different countries. I sent them my latest MRI results and waited for their advice. Almost all the doctors, from Israel, Poland, Ukraine, and Germany, agreed that I needed surgery with decompression and rigid spinal fixation. Only one Belgian specialist thought decompression alone would be enough. Their opinions varied widely on how many segments needed to be stabilized. So I started looking for clinics in Germany that perform such surgeries. I carefully read patient reviews and researched the surgeons' names. Eventually, I narrowed it down to 4 hospitals, 1 in Cologne, 1 in Munich, and 2 in Bonn. Looking for surgeons, experienced and not bloodthirsty. By that point, I had come to terms with the need for surgery. And when I learned that similar operations had been undergone by Russian figure skater Plushenko and German footballer Gundogan, I felt truly uplifted. Those cases really encouraged me, especially Gundogan's. First, because he had surgery here in Germany, and second, because afterward he continued playing for both club and national team, even captaining the Bundesteam. I scheduled consultations at all the clinics I had shortlisted. My goal was to find specialists who would offer the least invasive surgical option. I spoke with the surgeons in Munich via video call, and met in person with those in Cologne and one clinic in Bonn. The appointment at the second Bonn hospital was scheduled a month later, and I was actually thinking of cancelling it. By then, I had already chosen the neurosurgeons in Cologne. I liked the clinic, and the way the young specialists communicated. They were the ones, by the way, who told me about Gundogan. And in situations like this, I realized, you really have to trust your intuition. So I had spoken with nearly all the specialists I'd selected. All the formalities were done, the surgery date was set. But there was still one more appointment left, at a hospital just 15 minutes from home. I was about to cancel it, but then the phone rang. It was Cologne, calling to discuss some formalities. I asked who would be performing the surgery. They said one of the surgeons would operate, but if I wanted the head of department, the professor, to be involved, I'd need to reschedule the surgery and likely pay extra, beyond what my insurance would cover. So just in case, I decided not to cancel the Bonn hospital appointment. And 2 days later, I went there. At the spinal surgery and neurosurgery department of the Bonn hospital, I was greeted by the deputy chief physician, a young, very friendly female surgeon. And from the very first minutes, she completely won me over with her openness, competence, ability to explain things clearly, and above all, her constructive optimism. It's hard to put into words, I don't know. She genuinely reassured me and convinced me. She gave me a sense of confidence that everything would be okay, and that it would be okay specifically there. Together, we looked at my MRI results on the computer, then she answered all my questions, and I had a lot. And the whole time, she had a very open, very sincere smile on her face. When I asked who would be operating on me, she said, "We're used to working as a team. We always do everything together under the professor's supervision." Then I asked her if I'd be able to fence again afterward. And she confidently said, "Yes, I think you will." Though before that, she asked me to show a few movements right there in the office. With my wrecked spine, I did something awkward, it must have looked pretty funny, and after that she said, "Yes, I think you'll be able to fence." Vacation is sacred. When I got home, I called Cologne, thanked the doctors for their willingness to help, and cancelled the surgery. And finally, I breathed a sigh of relief, because everything was finally settled. But the biggest surprise was still ahead. In the pre-op documents I received from the Bonn hospital, under prescribed treatment, it said, surgery with spinal canal decompression at the L3, L4 level, followed by dynamic stabilization of the segment. That meant the segment wouldn't be permanently fixed, and possibly without removing the intervertebral disc. It also reduced the risk of future issues in adjacent segments. Later I found out that, at the time, not many patients had received this particular implant from a German medical device company. The first surgery using it had been performed less than 2 years before mine, and even now, as far as I know, it's not used in every clinic in Germany. I didn't ask my surgeons why they chose this method in my case, but I'm sure the stability of the spondylolisthesis played a role, so that functional X-ray turned out to be crucial. There was just under a month left before surgery, and we went on vacation again, to the Baltic Sea. Honestly, it was a risky move. I could only walk for any length of time after taking a solid dose of Tylodyne, and even then, I had to stop and bend forward every 50 meters or so. But family vacations are sacred to me. Besides, we didn't know if we'd be able to do it again next year. Despite everything, I tried to walk more. And I started doing exercises lying down, ones that could help speed up my recovery after surgery. And I was already looking forward to the surgery, literally counting the days. And during those days, I felt no fear at all, even though I'd watched videos of similar surgeries and signed off on the list of horrors that could await me if things went wrong. But the pain kept getting worse, and mentally I was on the edge. In the last couple of months, I had to constantly hold myself together, smile through the pain, even joke around sometimes, just so I wouldn't upset my loved ones and friends. Every time my weakening leg gave out, I immediately remembered the doctor's words about the wheelchair. Have you already picked a dream? The most vivid impression from the surgery, odd as it may sound, was the work of the anesthesiologists, which makes sense. It's the only part one actually remember. When I was wheeled into the operating room, the surgeons weren't there yet. Music was playing, one of the female assistants was even dancing a little. They kept talking to me, joking around. And the last thing I remember was someone saying, "So, have you already picked a dreaming?" Then I blacked out, and instantly woke up. That's how I remember it. In reality, of course, the surgery lasted about 2 hours. Right afterward, they gave me a special device, a kind of pump, so I could self-administer oxycodone intravenously. The device is designed so you can't exceed the allowed dose within a given time interval. The surgery was in the morning, and just a few hours later I was able to walk carefully, holding onto the wall. And almost immediately after moving to the ward, I started doing exercises, lying down, of course. Just ankle flexions and extensions, and circular foot movements. On the second day, I went out to the hospital courtyard and immediately noticed my left leg coming back to life. The deep pain I used to feel was gone. Only the surgical site was sore. But I had 4 painkillers and that pump, the pair. On the 6th day, I was discharged and handed over to my family doctor, orthopedist, and physiotherapists. The surgeons sent them reports from the operation with recommendations. I still had mild numbness in my big toes and outer calves. The surgeons said that would be permanent. And it seems they were right, I still have that numbness. Unfortunately, the stenosis had irreversibly damaged the sensory nerves, which serve to protect the more critical motor nerves. They're the first to take the hit. But it's something you can live with. From that point on, no one but the physiotherapists and myself could speed up my return to normal life. I have to say, I was incredibly lucky with my doctors, surgeons, and especially my physiotherapists. Though I'm a bit embarrassed to recall my first visit. I was afraid to do certain exercises, kept asking, "Can I do this? Is it safe?" I've got 4 screws in my spine. But they worked with me patiently, explained the logic behind each exercise, joked around, were open and optimistic from the very beginning. They told me about the latest research in rehabilitation. And overall, they helped me tremendously. But most importantly, the physiotherapists who worked with me charged me with their optimism, gave me confidence in myself. And just like the wonderful surgeon who first greeted me in Bonn, they were convinced I'd return to the fencing strip. And fencing, for me, was, and still is, a deeply important part of my life. When I put on the mask and pick up the saber, it's like I'm back in my youth. It helps me disconnect for a while from all the problems and mentally recharge. Fencing, for me, is also a kind of marker of a full life.
Fencing, this, I, contact.
My condition kept improving day by day. By November, I was already doing strength training on machines. Each physical therapy session felt more like a workout at a fitness studio. I warmed up for 15 minutes on a stationary bike, then did 3 sets of exercises for my quadriceps, obliques, and hyperextensions. After each PT session, I continued recovering at home, carefully strengthening my back and core muscles. Or, as it's trendy to say now, the core. Luckily, we have a dog, so I've always had, and still have, at least 4,000 steps a day guaranteed. At the same time, I tackled another challenge, quitting opioids. I tapered off gradually, first reducing my oxycodone dose, then switching to Tylodyne, and slowly cutting back every 2 days. It took me 2 months to quit completely. Though honestly, I probably could have done it faster. Thing is, I was taking Tylodyne combined with naloxone, which is part of the medication. Naloxone is an antidote that helps prevent opioid dependence. After stopping all medications, I began listening closely to my back, especially after doing exercises. Mild, barely noticeable pain remained in the right sacroiliac joint and slightly above along the spine. The latter feels more like muscle soreness. I felt it right after surgery, and it's still there. But it doesn't interfere with daily life or workouts. Muscle pain, by the way, I hope it's muscle pain, goes away for a long time after kneading with the anti-trigger ball. So it's probably some old trigger points. The biggest lesson I've learned is that rehabilitation has a beginning, but probably no end. I think for the rest of my life I'll be strengthening my muscles and trying to keep them toned. Because now, they're my main hope. Another important aspect, vitamins, supplements, and weight control. I started eating less, and I take vitamins regularly, both natural, fruits and vegetables, and synthetic. As for supplements, I believe they help if you believe in them. If you don't believe in them, they won't help. The thing is, their effectiveness hasn't been scientifically proven yet. That's why I said, if you don't believe in them, don't take them. Much more important, in my view, is drinking enough water. At least 1.5 to 2 liters a day, and eating fruits, vegetables, and fish. At the office, I work standing at my computer for at least 2 hours a day. During rehab, once I returned to work, after being discharged, I did resistance band exercises to rebuild my legs. I also worked trigger points with a hard ball and did planks right in the office. One thing I want to emphasize, throughout all the pain and treatment, I felt unwavering support from my family, friends, and colleagues. I'm deeply grateful to them. That's absolutely priceless. It's worth more than any painkillers, supplements, vitamins, or opioids. Money matters. Honestly, until someone asked me about it, I had no idea how much my surgeries and hospital stay had cost. We hadn't really calculated the money I spent on procedures not covered by my health insurance fund. I'm not a private patient, I'm insured through a public health insurance fund, not a private company. That's why I had to pay for some services out of pocket. But as it turned out, those were actually the least effective procedures. American chiropractic, at least in my case, Thai massage, loads of over-the-counter pills, creams, gels, and a few extra pain relief injections. All of that cost me less than 1,000 euros. But everything that actually helped, even symptomatically, including strong painkillers, acupuncture, physiotherapy, 3 rounds of inpatient pain therapy, and the surgery itself, was 95% covered by my health insurance fund. All MRIs were also fully covered, 100%. To get the exact total cost of my treatment, I'd have to contact the insurance fund. But there's no need, so I roughly estimated using public sources, and in my case, the total came to about €25,000. As for all other personal expenses, medications, gas, parking at medical facilities, doctors' offices, we included all of that in our tax return, and got some of it reimbursed. Comeback. An ordinary miracle. In January 2025, just as I had planned, I returned to the fencing hall, this time for training, not just as a visitor, like I had been all this time. On the first day, I stuck to the exercise machines, footwork, moving in fighting stance, and 2 or 3 sparring bouts. And when, after such a long break, I put on my fencing mask, I felt like the happiest person alive. It's hard to put those emotions into words. I started training once a week, then twice, gradually increasing the intensity. I built up the load slowly, step by step. And the care shown by my clubmates was incredibly touching. The guys and girls kept an eye on me, making sure I didn't overdo it. They monitored my physical activity. It was truly, deeply moving. Only at the end of March did I have my first full fencing training session. And from day one, every session starts in the gym, with strength exercises for the back, and footwork drills, as I mentioned before, special movements in fighting stance, including left-handed stance. That's how I try to compensate for the asymmetry that's typical in fencing. And then, 2 real miracles happened. At the end of April, I decided to go to the German Veterans Championship. I just missed my fencing friends, missed everything about tournaments, the atmosphere. I was greeted so warmly. It felt amazing to know people were happy to see me back, to see me return to the fencing strip after all my struggles. To be honest, I didn't even notice how I reached the final, and in the final, I beat one of the strongest opponents. And I just couldn't believe it was all really happening. Not a dream. The guys were joking, of course. Some winked and asked to see the scar, like, is there really a scar? Did you even have surgery? Others asked what kind of chip I'd had implanted. When I got home, I immediately wrote to my doctors to thank them for their work, and for this genuine miracle. Meanwhile, all the veteran fencers were preparing for the European Championship, scheduled for late May to early June in the Bulgarian city of Plovdiv. I hadn't planned to go at all, but after returning home from the German Championship, I started thinking about it, especially since I'd never been to Bulgaria. And I had friends in Plovdiv, including my former coach from Bonn, who had finished his coaching career in Bonn and returned to his hometown with his wife. But there wasn't much time to think, because registration closed in just 2 days. I spent the whole day pacing around the apartment, and finally decided to go. I contacted our club president and a veterans representative from the National Fencing Federation, and they managed to squeeze me in at the last minute. The tournament in Plovdiv became a true triumph for my doctors, my surgeons, and my physiotherapists, and a personal celebration for me. I reunited with old friends from different countries. It was a very warm reunion. Many of them had supported me all this time, sending messages through social media and chats. The support was truly overwhelming. The day before the competition, my friends showed me around their hometown. And during the tournament, Dioki became my coach again. He seconded my matches. In the direct elimination round I managed to win tough bouts against opponents who rank among the top in the world veteran ranking. In the end, I became European champion. And just like that, another miracle happened. But a miracle, I've learned, is something that only happens if you truly believe in it. And if you're not fighting alone, but alongside world-class doctors, loving family, and loyal friends. Instead of an ellipsis. It's hard to sum up this whole story in a single sentence. On one hand, if I hadn't been so stubborn for so long, I wouldn't have lost so much time and could have avoided the numbness. But on the other hand, if I had agreed to the very first surgery they suggested, I'd probably be living now with 10 screws, or 8 screws and 4 fused segments. And even if I had done my research early on and ended up at the same hospital where I eventually had surgery, there's no guarantee that the Bond surgeons had already mastered this new technique at the time. And so it goes. And I want to emphasize, my story isn't about miraculously becoming healthy after a single surgery. Of course not. The doctor successfully addressed the main issue, the most critical part of my lumbar spine. Everything else is still there and occasionally bothers me, but it no longer prevents me from living the way I'm used to. And every time my lower back or legs ache after training, or I feel even the slightest discomfort in my legs or spine, I do feel a bit of anxiety. Well, I guess that's something I'll live with now. And it's clear I won't get healthier with age, but I can slow down the wear and tear on my spine and the rest of my equipment. So that's it, I suppose. Thanks for watching. If you have questions, feel free to leave a comment. All the best to you. Stay healthy, believe in yourself, and never give up. Never.